Hi, I'm Dr. Neerav Goyal. I'm a senior consultant in liver transplant at Indraprastha Apollo Hospital, New Delhi. Baby Noor is a 10-month-old child who came to us about 2 months back from Malaysia as a patient of biliary atresia, in which the bile ducts are not formed. They are malformed since birth. These children, they require a liver transplant usually within the first year of their life if a procedure which is called Kasai has not been done timely, and that usually is the scenario. It's not usually done timely because an early detection of this disease is not always possible. However, when we evaluated this child also has heterotaxy, which is a condition in which the arrangement of the organs inside the body is not what we call as normal. They are kind of misplaced. In her case, the heart, which is usually on the left side, was lying on the right side. The liver, which is usually lying on the right side, was lying in the midline. Multiple spleens were present and not in the normal position. The intestines were in an abnormal position. The stomach also was in an abnormal position. Now this creates a lot of challenge for surgery as well as for preparation of surgery. We found that initial preparation, her heart function was not well, and she would get episodes of rhythm abnormality, and which can become very dangerous during surgery. So to tide over these, we had to evaluate her in detail and also consider pacing the heart with a pacemaker. To top it all, she also came to us with COVID scenario in the country and worldwide, so they had to be put into quarantine for the same. Now the child has recovered and has been discharged and is about to go back to her own country, and we do wish the very best for her future, and we hope it is a bright future. Thank you.
Hello, my name is Muhammad Hakim bin Hud. This is my wife Nurul Husna binti Muhammad. I'm a father of baby Noor Izofia Haira. She is 10 months old and we are from Malaysia. My daughter has suffering hepatic biliary atresia with dextrocardia with midline liver since birth. Before we came here, my daughter have a treatment at Kuala Lumpur. At there, my daughter had a portal hypertension bleeding. At that time, my daughter can pass away at any time. Thanks to God, she survived. With the kindness of doctor at there, they advised us to come here at Apollo Hospitals, New Delhi, to do the liver transplant. At here, we meet Dr. Anupam Sibal, Director Pediatric Hepatologist, and Dr. Neerav Goyal, Transplant Surgeons. We arrived here at 9th of March 2020. After that, we've been quarantined for 2 weeks because of COVID-19. When after the quarantine was over, we continue all of our procedure to do the liver transplant. On 31st of March 2020, my daughter are going for transplant and my wife as a donor. The surgery have successfully done with the experience of all the doctor in here. I'm really happy.
Hello, my name is Dr. Anupam Sibal. I'm a pediatric gastroenterologist at the Apollo Hospital in Delhi and the Group Medical Director of the Apollo Hospitals Group. Baby Noor's story is a story of overcoming challenges, numerous challenges. She was getting ready to be transferred to India when she developed bleeding, had to get into hospital, went on to a ventilator, and then the flight had to be cancelled. A few weeks later, she was ready to come to India. She got onto a plane, landed, and just then an advisory was issued wherein every foreign resident coming into the country from selected countries needed to go into quarantine, and she went into quarantine. After the quarantine was over, she developed bradycardia and needed a pacemaker. Her bilirubin level had become 45, she was severely malnourished, very bloated, she was very miserable, irritable, and that really made her case very high risk because in addition to biliary atresia and her overall precarious condition, she also had heterotaxy that brings about its own challenges. She underwent her liver transplant. Her mother was a donor. She had an uneventful stay, and 3 weeks later she was ready to be discharged and now is ready to go back to Malaysia, and we await guidelines on when she can fly back.